Hi, this is Dr. Erica Peirson, and I'm presenting today on mitochondrial dysfunction, gastrointestinal microbiome, and folate receptor antibodies in patients with autism spectrum disorder. These are three key areas that we find clinically when we work to improve them and address them and assess for them are very helpful for our patients with autism. And so, of course, the objectives then are around these three areas. And naturally, there are other causes of autism in children, certain infections and inflammation and immune system dysfunction. But a lot of these the core of those issues come back to mitochondrial dysfunction, um, gastrointestinal microbiome issues. And then the presence of these folate receptor antibodies is really exciting and sort of newer information that has been helpful for a lot of patients with autism as well. So first to talk about mitochondrial dysfunction, and where this really comes down to is brain energetics. The brain is a very energetic organ of the body, and I'll get into some details around that specifically. But mitochondrial function, is very important for neurodevelopment. So, brief overview. I don't want to insult anybody with these kind of high school level images of mitochondrial function, but just to quick review and to highlight that when we are addressing mitochondrial function, we are looking at all areas of mitochondria, not just the electron transport chain, not just glycolysis. We're looking at fatty acid oxidation, which is not in this image, as well as the citric acid cycle, electron transport chain, etc. And it's a multiple step process with, of course, glucose being the main fuel for mitochondria. The mitochondria can use amino acids and, of course, fats as well. So these three phases are the most important. Again, I apologize for not having fatty acid oxidation here, which is very important as well. But glycolysis, of course, occurs outside of the mitochondria. There are the 10 steps of glycolysis that are involved. The glycolysis itself requires magnesium. And so assessing magnesium for our patients can be really important. Sometimes just supplying them with magnesium as a supplement or Epsom salt baths can be very helpful. And what I want to highlight here is the end product of glycolysis, of course, is pyruvic acid, which segues over to the citric acid cycle. And I'll get into kind of what that segue is. But of course, the citric acid cycle occurs within the mitochondrial matrix, requires oxygen, right? The two things that our mitochondria need the most are glucose and oxygen. And I've given lectures around this area to parents and talking about glucose and oxygen needed for mitochondrial function. And that it's very similar to when we burn a log of wood, we are using the glucose in the wood as the main source, and that fire, that energy doesn't come out of that glucose unless that oxygen is present. So those two things are very important. And citric acid cycle starts with an enzyme called pyruvate dehydrogenase complex. And again, I've got some more information on that coming up. That's a really important step that I think gets missed sometimes clinically when we're looking at these steps in mitochondrial function for our patients. And of course, B vitamins. I'll get into details here again that the citric acid cycle requires various levels of various B vitamins. The electron transport chain, this is where a lot of oxidative stress occurs. This is where electrons are carried through, of course, from complex 1 to complex 2, and then eventually to the ATP synthase enzyme that makes ATP. It's located on the inner membrane of the mitochondria and requires the cofactors CoQ10, riboflavin, and niacin. So again, the area I want to highlight here within the citric acid cycle, I've got them all the B vitamins. This thing is just littered with B vitamins. I taught this, tutored my son recently when he took this cell biology, when he took biology in high school. And, we're taught about the citric acid cycle and all the steps of the citric acid cycle. But it gets missed, I think, in our conventional training that the B vitamins are really important here. Of course, we as naturopathic physicians are familiar with these B vitamins, but here's where they play a big role. And I want to highlight, I'm not sure if I don't think I have a cursor here that works, but if you look up towards the top there and you see pyruvate, and pyruvate, of course, is brought into the mitochondria and is converted to acetyl-CoA. And if you can see that little PD there, that's pyruvate dehydrogenase. And that's a really important enzyme that I'm going to focus on the next slide. We call that the key to the front door. If that enzyme right there, that PD, pyruvate dehydrogenase, is not functioning, nothing after it happens. It's the front gate, and it's really important. And you can already see kind of some start of information about on here how vitamin B1, B2, B3, and B5 are very important for that enzyme. But then highlighting that they're all important for other steps within the citric acid cycle. So here's a little video I have of the pyruvate dehydrogenase complex. It's a very large enzyme complex that that has several subunits to it. There are 3 subunits: E1, E2, and E3. Subunit, I don't have it here on the slide. I honestly forget. I believe subunit E3 needs vitamin B1. And it's one of the larger subunits. And so vitamin B1 actually is, out of these 3 cofactors that are needed here, vitamin B1 is a bit more important, but they're all important, of course. And as you know, vitamins as cofactors for enzymes is how vitamins work. Conventionally, vitamins aren't recognized as sort of being important in the body in some cases. And they actually are the cofactors that make these enzymes work. And so the pyruvate dehydrogenase complex, I encourage you to look into it. And I have a video on YouTube actually that's called Thiamine Deficiency in Children with Special Needs. And so it focuses all around thiamine, as it's something that I picked up in some of my patients with autism. And thiamine, of course, as we all know, has been most well studied in the certain patient population of alcoholics, and of course, causing Wernicke-Korsakoff syndrome. When we look at the symptoms of Wernicke-Korsakoff syndrome, we're looking at speech and gross motor skills are affected. And in some of our patients with autism, this is exactly what we see, are speech delays, and then oftentimes we'll see some gross motor symptoms, low muscle tone. And certainly no one's going to experience a vitamin B1 deficiency in isolation. There will be other deficiencies secondary to the cause of the B1 deficiency in the first place. And I'll get to some of those causes here. But vitamin B1 deficiency, there are several papers online. And again, I review this thoroughly in my YouTube video on thiamine deficiency in children with special needs. I wish I'd linked to this here, but if you want to go even more depth into that, really important, and I'll talk about it a little bit more moving forward too. So, of course, the electron transport chain, right? This is where all those hydrogen ions get pumped on the other side of the mitochondrial membrane to form a concentration gradient that then forces the hydrogen ions to pass through that ATP synthase enzyme, that large blue enzyme at the end there to make ATP. And so here we need CoQ10. If you can see between complex 1 and complex 2, there's a Q right there. Excuse me, the Q is on top of complex 2. That's actually CoQ10. And it's the electron carrier that moves those electrons from complex 1 to complex 2. And what can happen here is these electrons can get dropped basically very easily as they're passing through these various complexes. And that's how oxidative stress occurs, right? Because free floating electrons will get picked up by oxygen and they will form superoxide, which is the oxygen molecule with an extra electron. And it's very damaging. And so the other factors here, vitamin B2, of course, is FAD, which is in the form of FADH2. And vitamin B3 is NADH, which of course comes from the citric acid cycle. And so those are also carrying electrons through the electron transport chain. So to support the full process of mitochondrial function, we look at all these factors for these kids. And so what kind of so the information we have on brain energy requirements, especially in children, but important for all of us, of course. The brain consumes the most energy per unit of weight of all organs in the human body. In children, that can be as much as 44 to 87%, right, of their glucose metabolism when they take a bite of an apple or some potato or some source of glucose, which we get from a lot of things. Of course, not just sugary things, but sugar plays a role here. A lot of that is going for brain energy requirements. Glucose is the main source of energy for the brain. Of course, ketones are a secondary source, but the brain prefers glucose. And so peak age requirement is 4 to 5 years of age. I've got a study coming up on the next slide where this information came from. 4 to 5 years of age is peak for energy requirements for the brain. And it's kind of where we start to see some parents report, of course, it can happen earlier. Signs and symptoms of autism can happen earlier. But we see this is where some of the diagnoses sometimes occur for children. And just to pause here on this energy requirement, in here in the United States, we are experiencing a metabolic crisis. It's being talked a lot about in some political circles, even. I don't know if you're familiar with Kelly Means and her new book, Energy. Kelly Means. She has a new book, something about energy. And so, so we're in a metabolic crisis, and pregnant mothers today are experiencing this metabolic crisis. A lot of it is due to our declining food quality, our increased consumption of glucose. It's become the norm now for kids and people to just consume large amounts of sugar, especially here in the United States. And this metabolic crisis is spilling over into our newborns, even, and our infants and our children. And it's playing a big role in their health, and I believe certainly contributing to the autism epidemic. So this is that study. It's a really great study. I've read this one several times, word for word. If you, do that, if you read studies like I do, the metabolic cost and evolutionary implications of human brain development. Really, really great paper. So here's a table from that study, which I thought was great. Glucose use of the human brain by age, grams per day in males. So upper left-hand corner is glucose uptake by the brain. And what's interesting here is you see it higher in males. The chart A is males and B is females. And, I don't think it's coincidental that we see a higher rate of autism in boys. They have a higher energetic demand for whatever reason. I don't know. I don't have an understanding of that just yet. But as this chart shows, they have a slightly high energetic demand for glucose uptake, within their brain or within their body, excuse me. And as it would follow, the brain, is involved there. And then we see that also on the bottom here for the resting metabolic rate. And so we see where the peak really occurs here is 4 to 5 years of age. So really great paper. So what's the evidence of mitochondrial dysfunction in our patients with autism? July of 2024, just this year, I think Dr. Fry and Dr. Rossignol, I was in a think tank with both of them, and Dr. Rossignol said it took him a couple of years to put this paper together. Really comprehensive look. They were looking at 204 articles, evaluating biomarkers of mitochondrial dysfunction in patients with autism spectrum disorder. And if you look there, you see one of the highest markers they see is pyruvate. 41% of patients with autism have an elevated pyruvate. And we will see an elevated pyruvate in their urine or their blood when it's not being converted to acetyl-CoA, when that pyruvate dehydrogenase complex is not functioning. And so to me, that's direct evidence that these children have a higher need. We'll get into the microbiome and gastrointestinal issues. They have a higher need for vitamin B1 and B2 and the cofactors for that enzyme. B12 and folate methylation, extremely important in these children. It's a whole nother lecture unto itself. They get a lot of press, right? And I think this vitamin B1 and B2, as they play a role in glucose metabolism, its need in the brain, this higher rate of pyruvate in these children, I think that's all evidence that these need to be addressed and, looked at in our kids. And I'll get to kind of how we do that. This paper is from 2014. I think it's one of the papers probably that they included in their meta-analysis. And they said the majority of children with autism, 6 out of 10, had complex 1 activity within the electron transport chain that was below average. And I think they have a pyruvate. 8 out of 10 cases, 8 out of 10 had higher pyruvate levels. Only 2 cases had higher lactate. So we do see a high lactate here sometimes in our kids too, which is the same lactate that you and I would experience if we had a really hard workout, hard day in the garden, or we ran, 10 miles or something. Your muscles are sore the next day. And so I've seen this in my patients on their test results, a high lactic acid in a child who's trying to develop and even learn to crawl and grow, and their muscles are sore. Not to mention the metabolic implications of that. So here's another paper from 2013, the role of thiamine in autism. A relationship between thiamine status and the development of autism has been established, with thiamine supplementation exhibiting a beneficial clinical effect on children with autism. And again, this is another paper that if you want to look for, I highly recommend. I've read it word for word many times. Thiamine in autism gets overlooked. Signs and symptoms, of course, mitochondrial dysfunction. We're talking about low metabolic rate, low muscle tone. Of course, this is due to low ATP production from mitochondria, but also low acetylcholine levels. Acetylcholine, I have a blog post on my website about acetylcholine synthesis. And of course, the acetyl group of that comes from pyruvate, that acetyl-CoA. Glucose metabolism is needed for the acetyl component of that acetylcholine, and then of course choline. So I often recommend choline to my patients just for its neuroprotective qualities, and then of course addressing any B vitamin deficiencies, glucose metabolism issues that can contribute to the other half of that formula, acetylcholine. Constipation, of course, again, low ATP, low energy production. The colon, the whole GI tract is very muscular, very dependent on muscle tone and mitochondrial function. Of course, looking at thyroid hormone, if all, totality of symptoms warrant that, are important. But gut motility is also dependent on acetylcholine levels. Of course, we'll see fatigue in these children, and that doesn't always present like the image I chose here. Fatigue for children can be irritability, poor focus, right? A lot of children with ADHD are actually very tired, right? Hyperactivity, they're exhausted. We call that tired wired. A lot of kids who are hyperactive, they're just, they have to stay moving because they're sort of afraid that they'll just fall asleep. Or a kid who falls asleep easily in the car because they're kind of more restrained. Those are all signs of fatigue. But again, it doesn't present as a kid who just wants to lay around, as it might with an adult. Hot and cold intolerance due to difficulty regulating body temperature. That can also be from thyroid or histamine issues as well. And there are other issues from mitochondrial dysfunction. Sometimes we'll see it in eye muscle dysfunction. We'll see ophthalmoplegia, strabismus, nystagmus. Those can be a sign of B1, B6, or B12 deficiencies. And then when you're looking at low muscle tone, you're just looking for dropped arches, a slap foot gait, a wrist drop, just their arms they're just a little bit more, floppy. And so, yeah, that's all kind of related to their low muscle tone. So how do we assess mitochondrial function? The number one test for that should all children with autism, in my opinion, should be screened for is an organic acid test. I've done thousands of these in children, and there's a little bit of an art to it, doing organic acid testing, where you're looking for corroborating markers, you're looking for patterns, You're looking for underlying causes of deficiencies, right? If something's indicating a deficiency on one aspect of the test, you're going back to the gut markers and seeing if it's a malabsorption issue or if there's yeast overgrowth, which is a big contributing factor to thiamine deficiency. That assessing an organic acid test, that's a whole lecture unto itself, but I highly recommend you look at any and all information you can on organic acid test when helping patients with autism. And so let's see, their byproducts, organic acids, are byproducts of protein, carbohydrate, and fat metabolism that spill into the urine at higher levels. I should finish my sentence there, at higher levels when there are vitamin deficiencies, metabolic dysfunction, etc. Some of these tests will include urine amino acids as well, and these will give us clues not only of mitochondrial dysfunction, but sulfation issues, B6 deficiencies, etc. If there's an imbalance in amino acids. But we're looking at alanine, for example, will be elevated in a urine amino acid test. In mitochondrial dysfunction, blood labs, you can look at lactate and pyruvate in blood. It has to be drawn very carefully, frozen immediately. It's not often done, so phlebotomists don't often do it accurately. And you can get it in a urine test, an organic acid test. But carnitine, something you can get in a blood test. Again, there are markers on the urine organic acid tests that indicate a need for carnitine, elevated fatty acids, for example. And then you can test a blood CoQ10 level, but there are markers on the organic acid test that indicate this need as well. Succinic acid will be high. And then the mito swab, that's a saliva test. I think the day of the conference at the PEDS A&P, a couple of us agreed that I don't feel the mito swab, it certainly can be done, and it just gives you more data to confirm what we typically already know by signs and symptoms, an organic acid test, maybe blood test. And a mito swab doesn't give you specific vitamin needs unless it's, maybe a complex 2 level is low. That might indicate a CoQ10 need, etc. But to me, it's adjunctive. It's an adjunctive test. Again, more papers here looking at the role that organic acid test plays in assessing mitochondrial function. And then as well as the use of amino acid and organic acid test in assessing developmental delay or intellectual disability. So these are generally recognized as functional medical tests, but there's a lot of PubMed research to support the need for these. And and so I often want parents to know that this is, there's PubMed research to support how this is helpful. So what do we do to treat mitochondrial dysfunction? After we've done our tests, right, assessed our patient, hopefully you can do an organic acid test. I don't like using protocols for mitochondrial dysfunction. When I'm working with young children, sometimes very young children, I want to be careful what I put in their bellies, right? Every supplement that we give our patients hits their microbiome first, and then the cells of their body get it second. And every supplement that we put into our patients or we take ourselves can impact our microbiome, sometimes negatively. So I'm just really careful. And I want to know exactly, especially when I'm dealing with young kids, I want to know exactly what they need, and of course the underlying cause. So treatment should be based on individual needs, right? I don't use protocols. Personally, some people do. And, there's a place for them, I suppose. If you've got a parent who can't afford this kind of testing and you want to give them just some general mitochondrial support, you likely see some improvement, but I like to really target things. Test, don't guess, right? And then run them when possible. I know these are expensive. Seeing us is often out of pocket for some families, an out-of-pocket cost if you have a cash-based practice, etc. But whenever possible, I offer these tests to families. But I have tools on either side, right? We can go empirically, and we can give some supplements based on my clinical experience and signs and symptoms, but then we can test if needed to, and always look for the root cause, right? When we find vitamin deficiencies, B12, B1, we want to ask why, right? And then even when we find the why, we still want to ask why, right? Why did that happen? And try to get as far back as you can in your patient's story to figure out why this happened and get to that root cause And again, for a lot of these um, vitamin deficiencies that these children do experience, a lot of times it's gastrointestinal. There's some genetics, of course, referring out your patients for genetic testing when you can't really get to the root cause and you're not really getting anywhere, referring for genetics. And I'm not just talking about SNPs and 23andMe tests and all that. I'm talking about seeing a geneticist and doing, a full, genetic panel sometimes is warranted. So treatment, right, of course, these are some of the tools in our toolbox for treating mitochondrial dysfunction. Magnesium first. I prefer magnesium glycinate. There's also malate and threonate. Not a huge fan of citrate. It's good for constipation, but citrate levels, I think there's some papers that show that it can potentially increase aluminum absorption. And magnesium oxide, again, great for constipation, but not absorbed really well. And then, of course, your Epsom salt baths. Magnesium sulfate is what you want to look for. Sulfate, again, a whole nother topic for these children. I think Dr. Adams talked about sulfur in his talk. Thiamine and riboflavin, I put those separate from a B complex because sometimes I need to use those in much higher doses than just a B complex. Yes, they taste terrible, right? Especially riboflavin. If a B complex doesn't taste good, it's typically because of the riboflavin. I recommend things like mango juice. It's very popular. I've told it masks it really well. Maybe mixing it with the juice, or white grape juice is also very sweet. Mix that in a syringe, follow that and shoot it in the mouth, off to the side of the cheek, and then follow it with a syringe of plain juice. To kind of chase it down. And then I think someone that day said something about start with the juice to kind of coat the tongue and then give the vitamin and then maybe some more juice after, kind of like sandwich it with the juice if you have to. So there are lots of tricks, and I tell parents, don't give up. This is like any other medicine your child needs, and keep trying. Sometimes putting these supplements, not always finding something sweet, maybe mixing them in, if the child will take it, in something like pesto or ketchup. I've heard ketchup is really popular. Applesauce, of course, is commonly used. My son never knew what real applesauce tasted like, and so I didn't want anyone to ever give him regular applesauce because he always had a little supplement or something in there. So lots of different tricks there. Carnitine, of course, really important for mitochondrial function and muscle tone and gut motility, especially gut motility. L-carnitine is a prescription form of it, but you can just get L-carnitine powder. You can use acetyl L-carnitine for the brain. I like to use just L-carnitine because it really helps for gut motility a little bit more than the acetyl L-carnitine. And of course, we're looking at doses here of sometimes up to 500 to 1,000 milligrams for carnitine, depending on the age and size of the child. One side effect of carnitine, especially if a kiddo has SIBO and sort of too much gut bacteria will take supplements, carnitine and choline. They will consume them, and they will make a compound called TMAO, trimethylamine oxide. TMAO, has a fishy smell. And it's not really I think it may come from their breath, may come from their stool and urine, but sometimes it's just from their pores. They just have a fishy odor to them. And so I'll have the parent, back down on the carnitine, and we work on, gut health, of course, finding the underlying cause of why that happened. And it's often something like SIBO. There's your CoQ10. Of course, anywhere from like 50 to 100 milligrams of CoQ10, 25 for a smaller child. Liposomal glutathione, a lot of those on the market today. I like oral. You can use topical, of course. I just question absorption with some of the topicals. Of course, they can be effective, but I prefer the oral if you can get one that tastes tolerable-ish. Iron bisglycinate, iron, really important for mitochondrial function. There are 2 steps, I think, citrate synthase, isocitrate dehydrogenase maybe needs iron. And then, of course, iron for energy in general and, hemoglobin synthesis, etc., oxygen delivery to the cells. Iron bisglycinate, best absorbed, non-constipating, typically, knock on wood. And then alpha lipoic acid. I've seen alpha lipoic acid. Oh, you want the the R form of alpha. Sorry, yes, it's the R form. I just paused and looked it up. Had a little brain fart there for a second. So the R form of alpha lipoic acid, yeah, I was right, is the active form. If you're recommending a supplement of alpha lipoic acid that doesn't say what form it is, it's probably the L form, and that's not as bioactive isomer. So you want the R form. And I've seen alpha lipoic acid. Some parents report a little bit of reflux with it, so I'm careful with it. There are supplements out there that include B1 and alpha lipoic acid together. So those are maybe something to try when warranted. So what's the role of the microbiome in all of this, especially in our children with autism spectrum disorder? The gut microbiome, of course, impacts our vitamin levels, impacts our mitochondrial dysfunction, and then vice versa. Mitochondrial dysfunction affects gut motility, which affects the microbiome. So all these things are connected. None of these really are in isolation. So the impact of gut health on brain development, right? Huge. Again, this is another area that we're in a little bit of a crisis with here, I think globally, not just in the US, although our antibiotic use in the US, I would argue, is probably higher than other countries. And there's a great book here, Martin Blaser, I believe. Yeah, it's Martin Blaser. Again, I paused again for a second there. Martin Blaser, Blaser. He wrote a book called Missing Microbes. He's got some great lectures on YouTube. And he's a microbiologist, and he talks about our microbiome depleted. I think he's traveled to some indigenous deep Amazon communities and studied their microbiome, and really, really fascinating work. And he highlights the fact that, yeah, globally our microbiome is changing, and our children are the canaries in the coal mine here. Because the gut is so important for our brain health. Things like neurotransmitters, as you see here, serotonin, dopamine, GABA, acetylcholine. These are all produced, from microbiome in the gut. Microbial metabolites from the gut also influence brain signaling. I'll talk about butyrate here in a minute. The vagus nerve really involved here, directly impacting brain development. The immune system, 70% or more of our immune system is in the gut, and dysbiosis, right, an imbalance of healthy or unhealthy gut bacteria can trigger autoimmunity. We know there's a higher autoimmune rate in children with autism and mothers of children with autism. And so, and then of course the role that inflammation in the gut can play. Inflammation in the gut leads to inflammation in the brain. Things like quinolinic acid are produced in the gut, triggering, and they're also produced in microglia in the brain. Lipopolysaccharides from the gut traveling up to the brain produce, triggering inflammation there. So there's a huge connection of the immune system and the role that the gut is playing there. Nutrient absorption and malabsorption, right? A lot of these kids are experiencing malabsorption. Like our nutrition is poor enough as it is. And then on top of that, because of microbiome issues, we can get literally malabsorption. I think that these deficiencies are under-recognized. We're almost coming full circle back to an era where our children were nutrient deficient. And even though they're appearing to eat enough calories, some of them, the quality of the nutrition is poor, their gut health is poor, and they are experiencing nutritional deficiencies. Dr. Derek Lonsdale, I should have mentioned him earlier when I was talking about vitamin B1. Derek Lonsdale, a lot of his work is on a website called hormonesmatter.com. I know it's an odd name, but that's where the website started, and then it kind of transitioned into some different work that he's doing with Dr. Chandler Mars. Dr. Lonsdale sadly passed away in May of this year at 100 years old. So he knew a thing or two about metabolism and health. And why was I talking about Dr. Lonsdale? Because he coined the term, I believe, high-calorie malnutrition. Right. So a lot of our kids appearing to eating enough food, but just not getting it, because of malabsorption and just poor nutrition. And of course, this leads to deficiencies that affect cognitive development and neural function. That short chain fatty acids, I've got a couple slides here coming up on butyrate. Beneficial bacteria make these short-chain fatty acids, especially butyrate, which have neuroprotective effects, support the integrity of the blood-brain barrier even. So really direct. It's not an indirect relationship here of the gut and the brain. There's a direct relationship here. And then we can get not only beneficial short-chain fatty acids, but an imbalance here, propionic acid. This is the work of Dr. Derek McFaby, who has several papers, or more than that even, looking at propionic acid and his studies showing that it's linked to autism. And of course, the short-chain fatty acids are modulating expression of brain-derived neurotrophic factors, a protein important for neuron growth and brain plasticity. Gut barrier integrity and the blood-brain barrier. A healthy gut barrier prevents harmful substances from entering the brain. So leaky gut, right? If we have propionic acid, lipopolysaccharides, these inflammatory compounds within our gut, if our gut integrity is not strong, then those things will easily get into our blood and travel up to our brain and cause issues there as well. Allowing toxins, the second bullet point there, to reach the brain. Metabolite and toxin clearance, right? Compounds like beta glucuronidase that I don't have listed here. These are enzymes in the gut that can interfere when they're at higher levels with glucuronidation, which is needed to, remove toxins from the body. They can interfere with bile, even carrying toxins. SIBO, elevated levels of bacteria in the gut, will interfere with bile carrying toxins, and bile will sort of literally let go of their toxins and they're released. And then, of course, affecting brain development. So the gut, right? I mean, this is where we shine, right? As naturopathic physicians, we've known for decades, right? We've been, saying this about gut health, and, we're of course grateful that it's being recognized more, but, we've been saying this for a long time. So butyrate, effects of butyrate on the intestines, right? Butyrate is really important. I encourage you to study anything you can about butyrate. You can take it as a supplement. It is one of the most sinky substances kind of on the planet, maybe. And so like the really, really stinky cheese that I don't know, I've only heard about, really. I forget what its name is called, but it's smelly because it's high in butyrate. Butter. That's where butyrate gets its word from. It's high in butyrate. But our body also makes it, right? And so we make it from healthy gut bacteria. When healthy gut bacteria eat certain prebiotics, which I'll get to. But it's important within the gut itself. It provides energy for enterocytes or colonocytes that line the intestines. Mucus synthesis, right? If you've got a kiddo who's constipated, right? How well is their stool lubricated? What's their mucosal layer in their gut, which of course is important for the gut integrity. And most of our immune system lies within that mucosal layer of the gut. Ketone body synthesis is related to butyrate levels, intestinal cell proliferation, differentiation, and maturation. Control of cytokines, pathogen control. This is all from this one paper, from the gut to the peripheral tissue, the multiple effects of butyrate, right? They even have effect on apoptosis of malignant cells. So there's a connection here, certainly between butyrate levels and colon cancer. And then control of intestinal barrier function. So butyrate, really important for the intestines itself. And then it's also important, butyrate has direct effects on the brain. So butyrate doesn't just stay in the gut. It does get, go systemic. In a positive way, it enhances sleep, reduces depression, reduces amyloid beta levels, increases neurogenesis in the hippocampus, regulates immune cell behavior, pathogen control again, even regulates gene expression. Butyrate impacts DNA transcription because it inhibits histone deacetylases. And so it directly, it's a histone deacetylase inhibitor, directly impacts DNA transcription even. So our genetics. And of course, it's an anti-inflammatory. So I have several papers, looking at the role that butyrate plays here. I think I have a social media post about butyrate too and all the roles it plays in the gut-brain connection. So just highlighting one level, and a lot of our stool test results will have butyrate stool tests, if you have a good one with short chain fatty acids, will tell you about butyrate levels in your kiddo. I wish there was a lab out there that just did butyrate levels, because some of these kids that's really sometimes just the only thing I kind of want to follow up on a stool test, and I want to test just that. So proportion of short chain fatty acids produced based on the prebiotic given. I highlighted resistant starch. And so foods high in resistant starch are raw oats, green bananas. Yeah, you can buy green banana flour powder, because I don't know who wants to eat a green banana. Potatoes that have been cooked and then cooled. You can't eat a raw potato. That's a little intense, but there is potato flour. I can't even name brands of that, I don't think, but potato starch you can look up. It's unmodified potato starch, and it tastes like nothing. Put it in a glass of water, increases potentially butyrate levels. It's a resistant starch. And then beans, kidney beans, lentils, legumes. Those are all overnight oats, or your raw oats, of course. Those will all are all good sources of butyrate, of resistant starch that will increase butyrate levels, given that the other half of that formula is there, which is healthy gut bacteria. This is a video. I'm not going to play it within the context of this lecture. I highly recommend you take a look at it. I've watched this so many times, this video. The guy's got a great British accent, and I say resistant starch is really good explanation here of how it works. I watched this so many times because I send it to families, and then it just plays as I'm charting because I linked to it in my chart. So it's really great for families, and I think for us too, to take a look at, and it explains why we're focusing on resistant starch and butyrate, and why we need this for healthy gut bacteria. So it's a great resource for you, I hope. This is an image that's really difficult to see because there's a lot going on here, but the paper is right there. Intermediate role of gut microbiota in vitamin nutrition and its influences on human health. So what we're looking at here is on the left are all your B vitamins. Those are the structures of your B vitamins, and where they are absorbed in the GI tract at various pHs, various locations within the gut, of course. And then on the right, we're seeing how these B vitamins are then made also by the gut bacteria. So our B vitamins, we don't only consume them in our diet, they're also made by gut bacteria. And so this is really important to understand when you are analyzing a stool analysis, looking at the microbiome. I have all these resources in front of me to really assess, why a kiddo is deficient in a B vitamin, which species or phylum of bacteria do we need to encourage, and what does the research tell us on how we encourage that targeted, phylum or species of bacteria. And, bless the researchers, a lot of that research is out there. For example, Fasciculobacterium is one of our most important butyrate producers, and it really likes kiwi. So do I recommend kiwi to my patients? Yes, of course, especially if their Fasciculobacterium on their microbiome test is low. Akkermansia, really important for the mucosal layer of the gut. It likes to eat dark purple grapes and cranberries. That research is out there, how to increase and improve Akkermansia levels. So these are the kind of things that, again, I don't have time to go into detail on how to analyze these test results, but hitting the highlights here. And so these B vitamins here, this chart shows the peach boxes here are the bacteria in the gut that make these B vitamins. And then in the yellow below are the effects when these B vitamins are deficient. Look at vitamin B2, for example. I'm not going to go through all these, but impairment of intestinal cell growth, right? So we'll have an unhealthy gut lining if a kiddo is deficient in vitamin B2. Defective mitosis, accumulation of aneuploidy cells in the colon. Vitamin B1, decreased abundance of Peirson patches, right? We know the important role that those play in the immune system. B6, decreased mucus secreting cells, right? Mucosa, and just mucus being really important for decreasing gut inflammation. And so I encourage you to pause on this, or if you want to go to the paper itself, B vitamins and their role in gut health, right? 2022, right? Really current stuff. So those are two really important concepts. What's the interplay of B vitamins in our gut microbiome to tie together the microbiome and mitochondrial function? So evidence of impaired gut health in our children with autism. This is just one example of one paper. There are so many papers out there. This one was focusing on the role of short-chain fatty acids and altered microbiota composition in autism spectrum disorder. This was a comprehensive literature review. And so they're giving some examples here of bacteria that might be high or low, but I wouldn't follow this as a rule. Test your kids for sure. And don't, just follow these kind of graphs, but just an example of a paper that shows there's altered microbiome in our kids, right? There are multiple papers out there. Here's another one, microbiome, gut mucosal immune brain axis in autism. So we see the development of autism is associated with dysbiosis and lack of diversity, right? So in order to have a diverse microbiome, we need a diverse diet. A lot of these kids are really picky eaters. I had one kiddo who had, what do you eat? Like hot dogs and ketchup and hummus. That's all he ate. And so we, of course, work on microbiome. We look at zinc levels because that's going to affect their taste of foods. And we slowly, ever so slowly with some of these kids, maybe even just sprinkling some prebiotics, sprinkling some probiotics into that hummus. So yeah, diversity being really important here. Not just looking for pathogenic bacteria. Less desirable microbiomes, of course, making toxic metabolites like propionic acid and lipopolysaccharides. Inflammatory cytokines we see, decreased diversity, less short-chain fatty acids, lower levels of neurotransmitter precursors. Remember, when we're affecting the microbiome, we're affecting neurotransmitters. And then constipation and behavior issues, right? Constipation. I'm part of a social media group, called Parents Against Miralax. So these are parents who are looking for alternatives for, constipation, because Miralax, I would, of course, as a naturopath, I hope you're avoiding Miralax. It has a really bad reputation. We need more studies on it, but there are some stories of some kids who are negatively impacted, and I believe it's likely because it's impacting our microbiome negatively, as well as the lining of the gut. But 96,000 members in this group, 96,000 parents, and it's on my social media page, so I see all the stories go by. All these kids constipated, really common today, and of course this can lead to behavior issues. And then modulation of the gut microbiome can effectively lessen the severity of autism. Absolutely. We see this every day in our practice. Those of us who are working with these children specializing in just these children, we see this all the time. And look, so, let me go back to that concept, because we talked about this at the conference, lessening the severity of autism, right? So this is controversial, I think, even among our colleagues, of, this idea of lessening autism in our kids. Look, none of us are trying to change our children and who they are at their core. What we're doing here is trying to make life easier for our kids. And a lot of these kids are struggling from the underlying medical causes of autism, right? They're struggling with constipation. They're struggling with pain. A lot of them, their GI issues are so significant, they're actually in pain. And because they're non-speakers, we just think these are behavioral issues that come with autism. And they're actually sometimes very uncomfortable headaches, gut pain. And so we're just trying to make, life more comfortable for them, and reveal their true self, and who they really are. And yes, I believe 100% that, in honoring neurodiversity, and but some of these kids are struggling from medical causes. So just to kind of highlight that. And my thoughts on that as I sit here alone. I love it when it's more of a discussion and in a group. I recommend you to come to the next conference in person. so these behaviors, right? So this is an interesting paper. I really did not like the conclusion of this paper because they said that gut issues essentially aren't contributing to autism. It's really an odd paper because I read the research they were looking at, and then their conclusion just totally took a left turn. But they had this great chart, behaviors that may be markers of abdominal pain in individuals with autism. This is really important because they can't often tell. Sometimes they can't tell you they're in pain, and we just have to look for clues. Of course, I mean, screaming, sobbing, sighing, whining, moaning, groaning, gritting your teeth, facial grimacing, right? I've had virtual appointments with families over the computer, and it's the parent says, "Oh yeah, they just do that," and it's uncomfortable because I have to say, I think your child is experiencing some pain and some discomfort, and maybe even some pain. Let's continue to work to try to find the cause of it. So take a look at this and really look at your kiddos from a different angle, and make sure your radar for pain is really high, right? Okay, let's see. So what do we do? So gut healing. Of course, you're going to put a Band-Aid on the boo-boo. You're going to use collagen, gelatin, broths, aloe, really soothing, glutamine for leaky gut, zinc, carnosine especially, but even zinc picolinate. All these things are our best tools, right? And then your mucilaginous herbs, slippery elm, marshmallow, of course. Psyllium can get a little bit gassy, but these are all really important. Using digestive enzymes when warranted, a low pancreatic elastase. I don't just throw digestive enzymes at kids until I have evidence that they actually need it. Your ginger, pineapple, papaya, ox bile, tricky. But if I've got a kiddo with gallbladder issues and evidence of that, we'll use it. But it does taste like vomit. I've tasted it myself. It's a tough one. I've had a couple parents who were able to use it. Prebiotics, of course, there's your resistant charts, your fructooligosaccharides, your inulin, your partially hydrogenated guar gum. I've got a chart coming up here that talks about prebiotics and which are kind of the most gentle and well tolerated. And then, of course, your probiotics. I mean, there are so many to look at here in different scenarios, but your S. boulardii, of course, and then your various lactobacillus strains that have been studied in autism and shown to be helpful, especially lactobacillus reuteri. But you're going to look at your bifidobacterium, of course, if you've got a kiddo with histamine issues and others. Fermented foods, of course, when warranted, and not just looking at fermenting dairy, but you can ferment carrots. You can ferment ketchup. Your pickles, of course. Coconut yogurt is fermented. And so, of course, being careful with this in a kiddo with SIBO. Your polyphenol-rich foods. All these polyphenols are feeding your healthy gut bacteria. And sometimes just finding really low doses, maybe finding a powder that you can sprinkle into their food just to get some of these into them early on. Vagus nerve stimulation, of course, really important for healing the gut and gut motility. Various ways of stimulating the vagus nerve. Just laughing, tickling your kids, getting them to laugh if they can. The vibration plates for exercise. You can get them on Amazon. I've got one sitting behind me right here that can be really helpful for gut motility. I've had some kids who are really constipated, can't poop well, and the parents should have them sit on the vibration plate, but that'll get a kid moving. Grapefruit seed extract, of course, your antimicrobials when warranted. Uva ursi. I've seen uva ursi. I know we know of it as for UTIs, but really helpful for certain gut infections. Of course, being careful, not using it for more than 2 weeks. And then nystatin, even I'll use nystatin if I've got a kiddo with yeast overgrowth, but I don't do that often. It's the beauty of our herbs as they kind of work on multiple targets. I've got to pick up the pace here a little bit. I'm looking at the time. So this was a table I got from Dr. Heather Way. She's from Australia, and she was at the FMAPS conference in the fall of 2024. And so I modified her chart for this presentation, but this is from her. And so your better tolerated prebiotics, meaning fewer side effects, right? There's your HMO, of course, is in breast milk. Partially hydrogenated guar gum. This is one I usually start with. I think this is sun fiber. Really great for if you've got a kiddo with SIBO or bloating, but you also want to kind of, start to support their healthy gut bacteria. I'll use this one. There's your resistant starch. Again, really well tolerated. It's one of my go-tos. And then if you want to get into the kind of more targeted or more potent ones, just want to be careful using them in a kiddo who's got gut issues. You don't want to just throw your FOS at a kiddo if you don't know what's going on in their gut, in my opinion. And of course, lactulose is used for constipation because it, you do get a kind of strong response from it. And so this is overall rebalancing of gut microbiota. Microbiota is key to autism intervention. And so this is a review of several different studies you can take a look at just to kind of conclude that, this is definitely an area. If you're looking to help kids with autism, you got to look at their gut health. Okay, the last thing I'm going to talk about here, I'll probably go a little bit over an hour. Hopefully that's okay with all of you, because this one is really the key. They're all important, but this folate receptor antibodies in our patients with autism spectrum disorder, it's one of the number one talked about topics at these conferences like MAPS and others in helping our kids with special needs. So what are these? Folate transport, right, actually occurs, for simplification's sake, I'm going to say it occurs in two different receptors on the brain. Folate receptor alpha is the primary transport receptor for folate into the brain, transports methylfolate into the brain. There's a secondary receptor for folate called the reduced folate receptor. It's doesn't have as high as affinity for folate as the folate receptor alpha, but it's there. So these antibodies are formed and they block that folate receptor alpha receptor, Folate receptor autoantibodies bind to and disrupt and block the function of folate receptors. So we have binding and blocking antibodies for this. They were just discovered in May of 2005, and I know it's May because there was a very interesting paper in April of 2005 I'll share with you in a little bit. Dr. Raymaker in 2005 published a really great paper on this. And so they're present in 70% of children with a diagnosis of autism. This was Dr. Edward Quadros, and Dr. Rossignol and Dr. Fry, of course, have kind of taken over there, and they're experts in this area. And I don't know why this is not big news on CNN, MSNBC. This is shared more. It's because the treatment is a vitamin. But 70% of kids with autism, so all of them need to be screened for this. Of course, there are multiple causes of autism. This is a major one. We'll talk about testing here in a minute. So here's the first paper. On the bottom left is a story of a little girl who, for most of her life, she struggled with speech and gait disturbances. And she wasn't tested and until she was 12. They did a spinal tap and did a cerebral spinal fluid folate level, and her folate levels were found to be low. Dopamine and serotonin were also low because folate, I'm going to go deep here, I've got a blog post on this on my website, is connected to the tetrahydrobiopterin pathway, BH4, and that is needed for the production of serotonin and dopamine. So these levels were low, and they gave her 15 milligrams of folinic acid, and she had amazing results. That's the word they use, is amazing results. She regressed a little bit, I forget, a while later, and they increased her dose of folinic acid, which is the treatment for this, to 30 milligrams a day, with a second phase of remarkable results. And she had improved gross motor skills, and by 14, her speech was near normal. So this gives me cautious hope for families when I read stories like this. It's anecdotal, it's one story, when this was caught as late as 12 years old, and her speech was improved significantly to near normal by 14. So that was published in April of 2025. Above it is Raymaker's paper from May of 2005, where the autoantibodies were reported to be present in those with cerebral folate deficiency. And then, of course, on the right, we see it's present in autism. That's the Quadro study where you can see about probably halfway down in the abstract, 2/3 of the way down, 70%. Okay. And this is our colleague, Dr. Lindsay Wells, who I'm a huge fan of, love her. She did a paper on, I believe this was 47 of her patients with PANS and PANDAS, and she reported a 63% rate of these antibodies present in her kids with PANS and PANDAS. So these kids need to be screened as well. Here's what I'm finding in my practice, because I specialize in helping patients with Down syndrome. We see other genetic conditions. I could name a whole list of other full genetic conditions, not just SNPs, and then autism and PANS and PANDAS, of course, ADHD. So this is the rate I'm seeing. I had tested, the day of the conference, I had tested 12 patients, 100% positive in my patients with Down syndrome. These were patients, is this 12? No, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. There were 2 more. I now have 13. I wish I had updated this, but 100% rate in my patients with Down syndrome. And so I hope to get this published. These are kiddos who are a little bit more affected, which is why parents were willing to pay for the test. And we're going to test 20 more kids and hopefully get a paper published on that. So how do we test? fratnow.com, right? Go there, create an account, learn their process, go to the frat test drop-down menu, learn the collection instructions. You can't get this test done at LabCorp, Quest, Community Hospital, etc. You can have the blood draw drawn, of course, in your office if you do that. Or there are 2 labs nationally. Any Lab Test Now, if you go to their website, they can process it, and ARC Point Labs, ARC Point Labs, will process that as well. And of course, there's an additional fee. This test is about $295, and then the blood draw, of course, could be an additional fee for the family, but it's not a lot if you can pick this up as early as possible. This is really important, especially if your kiddo has autoimmune, or there's a history in the family of autoimmune conditions. And so this is an example of a positive result. I think that says 2.8 something, which is a fairly high result. And so anything around 1.5 is moderate. 2, I've got some kids at 3.9, which is really high. I've got some kids who have blocking and binding antibodies, significantly delayed. And of course, I always wish we had known sooner, but we get folinic acid in these kids, which I'll talk about here as the treatment. And we've seen some really nice results in speech, gross motor skills, just like the lights come on, increased engagement, faster processing, etc. So the high dose folinic acid, you can do over the counter folinic acid. Go on online. There are a couple of specialized, more professional grade companies like we work with. Anyways, folinic acid, you can get it online. You can have it compounded at pharmacies into a liquid, or you can just go any old kind of CVS pharmacy, leucovorin tablets. They've got it. It comes in 10, 15, 20, and 25 milligram tablets, and your dose range is 0.5 to 2 milligrams per kilogram per day. I recently was at the TACA conference, and I've got some colleagues using 1 to 4 milligrams per kilogram per day. Go slowly, right? I usually start around 5 milligrams, depending on their antibody levels, and if I've got an actual test result, sometimes we'll start at 10 or 15. Increase the dose slowly over a course of a few weeks. And this is the form of folate that uses that reduced folate carrier, because folinic acid is a reduced form of folate. The other part is you want to do 100% dairy-free diet. That's from a paper, Milk-Free Diet down regulates these antibodies. One likely mechanism for this is the exposure to dairy. So they believe that these antibodies are coming through dairy, which is how the kids are getting them, or it's coming from the parents, which is the next thing. A lot of my parents are wanting to be tested because that's the other source of these antibodies as they're born with it. And of course, assessing for the triggers of autoimmunity, which is your gut health, etc. Excuse me. So this was in the Edward Quadros study. If you want to read about this coming from parents, this is this study right here. He's got a good lecture online about it too, Edward V. Quadros. Okay. So side effects from folinic acid. This is from Dr. Fry's and Rossignol's paper. Side effects can occur around 3 to 6 weeks. We saw that in placebo as well, though. But within the folinic acid group, those side effects drop precipitously by around week 9. And those side effects can be, agitation, excitation, trouble sleeping. And I tell parents that's a sign that things are turning on in the brain. It's a sign that it's working. It's not a sign that it's not the right thing for your child. And so I'm not there to, manage those side effects. If they want to go slower with introducing it, they can, but know that we've got to get to, a really good dose to see some benefits. And it's around week 9 or 12 where we start to see the benefits when those side effects subside. So it improves verbal communication in children with autism. Again, this is a Fry and Rossignol paper. And excuse me, I don't think Rossignol was on this paper, but Dr. Quadros worked with Dr. Fry on this. And it absolutely, again, we see this every day in our clinic. I don't have time for a case report here, but this is the wow thing that we're seeing in a lot of my kiddos and of course with Down syndrome as well. So want to integrate mitochondrial support with gut health, a need for certain vitamins like thiamine I focused on. There are many other V vitamins you want to look at in testing, and folate, of course, being important for optimal brain development, providing a comprehensive approach for improving the health, cognition, and quality of life. Quality of life, right? We're not trying to change these kids. We're not trying to make them normal, right? None of that language at all is appropriate. These kids are 100% there. There was a comment made at the conference that I had to counter during my lecture. Speech is not a measure of cognition. Speech is a motor skill, just like gymnastics, skiing, right? If a child is unable to form words or language, that language is there, right? They know they've got it. And all this will provide a foundation for better development and outcomes for our kids, which is what we all want. So that's me. I asked questions during the conference. I highly encourage you to, come to conference in person if you can. That's where the real conversation happens outside of these lectures. So thank you for your time. I hope this was helpful for you, not in just helping our kids with autism, but other sensory and neurodevelopmental issues. And get in touch. If you ever want a consult or anything, I'm here, and hope to see you guys at the next conference. Thanks a lot.